So after discussing about the definition and types of blood pressure, let's discuss in brief about the determinants of arterial blood pressure. So the first determinant is cardiac output. Now what is cardiac output? The definition, it lies in the name itself. Cardiac means heart, output means something that is ejected outside. So the amount of blood that is ejected out of heart or out of ventricle per minute, it is called as cardiac output. And the normal value, it is around 5 to 6 liters per minute. So this output from the heart, it is determined by two things: strokes volume and heart rate. So what is strokes volume? Again, the definition lies in the name. The amount of blood that is ejected out of the heart per stroke means per beat. It is called as strokes volume, and normal value it is around 70 ml. Second determinant of blood pressure, it is total peripheral resistance. Total peripheral resistance, it varies inversely with the elasticity of blood vessel. That means if the blood vessel undergoes dilation, the condition is called as vasodilation, there will be fall in the total peripheral resistance, and the vessel will undergo constriction, there will be increase in the total peripheral resistance. So what is meant by increase and decrease? Whenever decrease in resistance, that means fall in the diastolic blood pressure, and rise means increase in the diastolic blood pressure. Okay. Now coming towards next determinant, diameter of blood vessel. How the diameter of blood vessel is going to affect the blood pressure. More will be the diameter, more will be the peripheral, lesser will be the peripheral vascular resistance, and there will be fall in the arterial blood pressure. Okay, and lesser will be the diameter, means more will be the resistance, and increase in the blood pressure will be seen. Next factor is viscosity of blood. Again, more will be the viscosity, more will be the peripheral vascular resistance, because increase in viscosity means increase in resistance towards the flow of blood, and increase in peripheral vascular resistance means increase in diastolic blood pressure. Vice versa is also true. Decrease in the viscosity means decrease in the resistance, and fall in the arterial blood pressure will be observed. Next, velocity of blood flow. It varies directly proportional to blood pressure. More will be the velocity of blood flow. Okay, more will be the velocity, more will be the resistance, and there will be increase in the arterial blood pressure. Now here are some factors that affect the arterial blood pressure. First factor is age. How does age affect blood pressure? It varies directly. With increase in advancement of the age, there will be increase in blood pressure. Now what is the reason? Reason is age-related hardening of blood vessels. Okay. Second factor is sex or gender. Before menopause, it is lesser in females, and reason being because of the estrogenic effect. But after menopause, there is slight increase in blood pressure. Okay, rise is seen after menopause. During sleep, there will be slight fall in blood pressure as the person is relaxed. During emotions, because of the higher sympathetic activity, increase in blood pressure will be observed. What is the reason? Because increase in sympathetic activity, it will increase cardiac output, it will increase heart rate, and both these factors are the determinants of blood pressure. Next reason is your climate. In hot climate, there will be fall in arterial blood pressure because of vasodilation. The blood vessels, they will undergo dilation, and vice versa. During cold climate, there will be vasoconstriction, and that will in turn affect blood pressure. It will cause rise in blood pressure. Next factor is gravity. It is a very, very, very important factor in the determination of blood pressure. Taking the zero reference level at the level of heart means at the level of right atrium. In the blood vessels that are below the heart, there will be increase in the blood pressure, whereas the vessels above the heart, they will show vice versa effect, declining blood pressure. Reason being gravitational effect. 0.77 centimeter with each per centimeter increase or decrease in the gravitational effect. Okay, taking the heart at the zero reference level, that is at right atrium, more blood pressure will be seen in the vessels below the heart, whereas lesser will be seen in the vessels above the heart. Exercise, again it will increase the blood pressure, it will affect BP. Posture, a very, very, very important one. Okay, immediately on standing, when the person stands up from supine position, on immediately standing, what will happen? There will be slight diminution of the vision. Person can experience lightheadedness. Why does that happen? Because the blood flow towards head, it will decrease, and most of the blood flow, it will be towards the lower limbs or lower side of the body, and here comes the role of baroreceptors. Okay, that we shall discuss in detail. It is a very, very important point that will affect the regulation of blood pressure, but here in short we can understand that immediately on standing up from the supine position or standing position, will observe a slight fall in blood pressure. So those were the factors that affect blood pressure.